The Honorable Lourdes A. Leon Guerrero, Governor of Guam, Mega Hagen Guaman, and Linda Unkinko Denorsi, Director of Public Health and Social Services, Ms. Stephanie Kern Alley, Council of State and Territorial Epidemiologist, Applied Epidemiology Fellow, and Sergeant Fernando Esteves, Medical Operations and Logistics with the Physicians Advisory Group. And now the Governor for her remarks.
Thank you, Janella. Half a day. It has been obvious over the past few days, Guam has seen a significant decline in positive test results. Though it might be easy to believe that this is fate or good fortune, nothing about these results is a matter of luck. Everyone who stays home, except for essential business and exercises social distancing, is keeping Guam safe and ensuring that the number of people who test positive for COVID-19 is as low as possible. Yesterday, I discussed the 4 stages in COVID-19 response: containment, suppression, mitigation, and recovery. While my physician's advisory group says we are still in the containment, suppression, and mitigation stages, I am taking the necessary steps to prepare for our recovery. Today, I met with members of my recovery panel of advisors. Their purpose is to help me strike a balance between the health of our economy and our people. Their job is to draft policy for safely and incrementally lifting restrictions so we can go about returning to some sense of normalcy. These goals are important, but we will not rush because rushing could be deadly. In Singapore, parts of Japan, and South Korea, communities not so different from ours are learning that lifting restrictions too quickly can plunge them back into chaos. I must stress that these actions must be gradual and will not happen at all at once. I will not be comfortable lifting restrictions until we know the capacity of our hospital can sustain our healthcare needs and we are able to expand our testing capacity. We also need to be able to contact trace efficiently and effectively for any new case. For these reasons, our recovery plan will be implemented based on science, data, and evidence that we can keep you and your families as safe from COVID-19 as possible. But know this, our recovery plan will be ready when that day comes. We have come too far, we have lost too many, and we have given too much to begin lifting restrictions recklessly. The effects of these measures, the results of our work, will be in vain if we do not remain committed to the social isolation directive. If we continue our efforts, we will beat this virus sooner rather than later. Our plan appears to be working. Please stick with it and we'll get through this pandemic together. I'll now turn it over to Lyndon. She'll give us our update on COVID-19.
Thank you, Governor. Welcome. I have with me Stephanie Kern Galli, and she is the Council of State and Territorial Epidemiologist, Applied Epidemiology Fellow that is assigned to us at the Department of Public Health and Social Services through our contacts with US CDC. And thank you, Stephanie, for all your hard work that we are here today to share our wonderful dashboard to all of you. Prior to the implementation of this dashboard, we were given the opportunity to meet with all the mayors and to discuss with them the dashboard. And they all were in agreement to expose all the different villages and the data that we'll now provide to you. We're going to walk you through the steps in the COVID-19 dashboard. So with the assistance of Stephanie, you will first go to the Google website, and then you will type in dphss.guam.gov/COVID-19 and then type enter. And then you will see that they're going to ask you for a password. So the password you will type in is 1234. No, wait, because the internet's kind of slow.
And the
There.
password is
And
no
the
longer
password.
enabled.
Okay, no longer enabled. Okay. Alrighty.
Mhm.
And then, of course, you have to wait for it to populate. Now that it has populated, you can see on the dashboard to the left, we have the case count of 135. And then we have the confirmed cases of 132 and the probable case. Probable meaning that these are clinically diagnosed cases. We have 3. And so as you count the 132 plus the 3, gives you the case count of 135. 5 have deceased, and we have 97 that are fully recovered. And below the cumulative case count, there are 3 graphs that you can see. Different color coding. First, you have the number of cases in the orange line, and then you have a blue line, which is the number of recovered case, and then you have the pink line, which is the number of deaths. These are cumulative deaths, total deaths. And of course, on the x-axis, you'll see the date. And then as you start off with the first graph, the orange line, when we first started this whole COVID case, we started with about 3 cases. And as you journey through, as the days pass, and you can see as we move up the orange, you'll eventually reach the top where a couple days ago, we stayed very steady at 135 cases. And we have leveled off and flattened at this point in time to today at 135. Next, blue is again the number of our COVID positive cases that have recovered. As you can see, as you journey through the days, more and more people have recovered, and we're happy to report that as of today, 97 have recovered. And then finally, the pink line, again, as the days go by, we experience a death and so forth as the days go by to total 5 deaths as we speak. Thank you, Stephanie. We'll go on to the next. The next is our cases by sex. And of course, you have right in front of your screen the female cases, and there are 72, which is about 53.3%. And then you also have the male, which is 63 out of our 135 cases, which translates to 46.67% of our cases. Thank you, Stephanie. Next, we have the graph of our case by group. And as you can see, when we go to the 0 to 19 years, we have 1. From the 10 to 19 years, we have 7. And then you click the 30 to 39 years, we have 14, which is the same as the 30 to 39 years of age. Again, 14. Then we go up to the 40 to 49 years range, which is 24. And then the 50 to 59 years of age group, 25 cases. And then you click on the 60 to 69, which is the highest of all of the age groups. And that's the highest cases that we see, which is 34 positive cases. And then you come down to the 70 to 79 year range, which is 11. And then you go to the 80 to 89 years, which we have 4. And then the final 90 and 90 years and above, we have 1 case. Thank you, Stephanie. Next slide, please. We go now to the ethnicity. We have the Chamorros at 62 of them being COVID positive, which translate the 62 out of 135 at 45.93%. Then we have the Filipino is the next largest group, 56 out of 135 or 41.48%. And then we have in the pie, the other category, which lumps every other ethnic group. In this case, we have 17 cases translating to 12.5%. So you take 17 divided by the 135. And these other categories are the combination of American Indian, other Asian, other Native Hawaiians, and also Pacific Islanders. However, as time journeys through and we have more cases, we can further specify the breakdown of other ethnic groups, such as the FSM population, the Palauan, and also Marshallese. And that will occur once our numbers get a lot bigger. Thank you, Stephanie. And then finally, we have our cases by testing. And we have the total case on the front, as you can see, 135. And that is broken down into 132 being confirmed cases and 3 being probable cases, as I mentioned earlier. And then the breakdown of the 132, as we mentioned so many times, we get tests from different areas. For example, we have accumulated 116 tests from the Guam Public Health Laboratory, 11 from the U.S. Naval Hospital, 5 from the diagnostic laboratory services, and all that is inclusive to a total of 135. Thank you, Stephanie. Let's now proceed to the map. When we journey through the map, Stephanie will make our map a lot bigger. And so when we have been telling you just the regions of Guam, northern, central, and southern. Now we're going to share with you that we can do it by every single village. So Stephanie, let's start with the northern region. So here we have Dedido, and we have 41 cases. How many have recovered? 25. Next region of the northern, we have Jigo. So Jigo, you have 13, and 3 have recovered. And then we go to now the central region of the island, which is comprised of multiple villages, and we'll go into each one, Stephanie, starting with Tamuning. So when we click Tamuning, you'll find out that there are 15 cases and 11 have recovered. We're going to go to the next village now, which is Barragata. 13 have COVID positive cases, 11 have recovered. And then we go to the next village, which is Manilao. 15 cases, 9 have recovered. Next village, please. We have the Mongmong Toto Mighty. Cases of 1 has recovered. Next is we have the Aganya or Aganya, 0 cases. Next, please. We have Aganya Heights, 5 COVID positive cases, 4 have recovered. Next village, Sinahanya, 4 positive cases, 4 have recovered. And then we go down to Chanampago. We have 5 confirmed COVID positive cases, 3 have recovered. And then we now journey one more, Asan, which is in the central part, 0, no cases at all. And then we're gonna scroll down, and then we're gonna go to our southern area. We'll start with PD. 1 COVID positive, 1 has recovered. And then we go to the next village, Jonya, 5 confirmed cases and 4 have recovered. And then we go to Santa Rita, 1 COVID positive case, 1 has recovered. And then we go to Agate, 3 confirmed positive cases, 2 have recovered. And then we journey through Talifofo, 7 cases of COVID positive, 6 have recovered. And then we scroll down to our wonderful village of Umatak, no cases at all. Next, we go to Inalahan, for 2 cases of COVID positive, no one has recovered. And then finally, our last and final village, Maleso, 2 confirmed COVID positive cases, 1 has recovered. And so I hope our viewers enjoy our beautiful dashboard, as you can see behind me. And I just want to add on a few more things of all the travel history of all our COVID positive individuals. As I mentioned, 18 have travel history. 65% of those have traveled to multiple areas, and most of them are from the Philippines. 117 cases are not travel related. And because of that, we can do the breakdown of that 117. They are as follows: household contacts, 35. Community contacts, 13. Healthcare contacts, 19. And that is further broken down into 5 contacts as a patient, 14 as a healthcare worker, and then 50 have no reported contacts. To this date, we have 206 individuals that are quarantined in our Government of Guam facility. In addition to that, I'm happy to report as of April 16, yesterday, we have 10 that have cleared their 14-day quarantine in our area that we have them reside in. And on April 17, we have 2 that have cleared. And so the grand total from the beginning all the way to the current of all those individuals that have cleared 14-day quarantine amounts to 281. And right now we have only 13 in our Government of Guam isolation facility. Thank you, Governor.
Thank you, Linda. That is very informative.
Thank you. And thank you also to the hard work of Stephanie. I cannot take all the credit, but Stephanie has done a superb job. Thank you.
Thank you, Stephanie. Now we're open for question.
We'll begin with PDN, Jasmine Weiss.
Hey, Gov, thanks for doing this. I wanted to ask you about You mentioned yesterday about releases and the AG's decision to book and release 2 suspects in that Harmon terrorizing case. The AG responded to your comments and he alluded to the governor's preparing to return to standard confinement practices. Is that your understanding that GovGuam will return to standard confinement practices? What does that mean? Who will be confined? How do you balance adding detainees and ensuring that inmates and detainees are not exposed to the virus?
Standard confinement practices is, of course, what we normally do on a regular, normal basis in terms of arresting, booking, confinement, booking, and release. And of course, the main purpose for me is to make sure that our community is safe from these criminals or potential criminals. And so I had spoken to the AG and assured him that one of the things that I would like to do, because he is also concerned, and so is the director of Department of Corrections, about exposure to the Department of Corrections inmates, and also the detainees are there. So if possible, and people do not have to be detained, if they can be quickly expedited, that would be good. The other thing is that if we have criminals and there is a suspicion of them possibly being COVID potential, then we will of course test them. The director of Department of Corrections has identified a facility there for those inmates or those detainees who have positive COVID, which none have right now. But there is plans and there is preparation for facilities to house them in case that does happen. Again, the whole purpose is to try and minimize exposure to the Department of Corrections inmates. As you know, that's one side of an institution where you have congregations of individuals, which is of course one of the risk factors in contamination of COVID-19.
Your next question, Jasmine?
Yeah, you meant when you say quickly expedite that. Oh, sorry.
Just turn up your volume, please. We can't really hear you.
How is this?
Yes, better.
Much better. Thank
Okay,
you.
thanks. So when you say quickly expedite them, what do you mean?
I don't know how the courts work, but they have processes where when people are arrested and they go through regular magistrate, I guess, they go before the judge. That's their process. So I'm not familiar with what that is, but the goal there again is to try and move them through the process as quickly as possible.
Thank you, Jasmine. Next is PNC, Kevin Kerrigan.
I'd like to ask about the governor, about the conference call she had this morning with President Trump and the other governors. In your Facebook post this morning, Governor, you said that you were given some guidelines by the president that you will use to guide you in terms of possibly lifting restrictions. What are those guidelines and what restrictions may you be lifting?
Yeah. So Kevin, I did participate in a conference call with the president, the vice president, and his team of cabinet members who have been the experts in this whole coronavirus epidemic or pandemic, and of course, who have been advising him, along with 50 other governors and governors of states and territories. So his message to us is that he is going to be, and at that time he has not yet done his press conference, but he was going to push out the guidelines for open America again. And these are guidelines that have been vetted by his experts in CDC, Human Health Services, CMS, FEMA, and other experts that have produced these guidelines. And what the guidelines are. I don't have them right in front of me, but they are guidelines going through phases, 4 phases. And there's phase 1, 2, 3, and 4. And phase 1 is basically looking at what your data and your numbers are in your community, making sure that the fundamentals of social distancing, the fundamentals of washing your hands, all these preventive measures continue out throughout the 4 phases. And what they are looking at is what is going to trigger you to go to phase 1. And of course, like I said, science, data, and evidence will be the main factors that they would look at, meaning what is your infection rate? Can your hospital sustain the healthcare needs? What are your admission rates? Things like that. So he has put forward these guidelines. He has asked the states to look at these guidelines and use them as a basis for determining the beginnings of opening up their state. He also advised that this is not a mandate. He's not forcing people to open up their states, but to use these guidelines accordingly. And if governors from their various states feel that they cannot open their states at the moment, or even be able to begin with phase 1, he is saying that that's okay also. So I am taking these guidelines, and what I did was I established a recovery panel of advisors to advise me on what would be the best strategy, what the method would be, how would we go about it, what restrictions should we lift first, and so forth, and what data and the data that we should be looking at. So the panel is representative of physicians, business people, our government agencies, our tourist agencies, and hopefully as we move forward with this pandemic situation, that we can, that I will have the policy and I will have the guidance, and we can start looking at when we can trigger the restrictions being lifted. And if we do that, it's very clear from the panel that it would be done gradually, and it would be done with great monitoring, contact tracing, testing, all those measures that we need to do in order to continue to give us the confidence that we are safe and that contamination and transmission is at a minimum, if any.
Thank you. A follow-up question. I'd like to renew the question I asked yesterday. We see from public health that there were again 0 positives yesterday, the 4th day in a row that public health has come up with 0 positives. Yet only 11 samples were tested yesterday. We've been told that only the most likely candidates are selected for testing. So the question again is, what's going on? Why haven't we found more positives?
Can I just quickly, before Linda?
Sure.
I think, these specimens come to us or to public health via the clinics and GMH and so forth. So people aren't presenting themselves to the clinics and so forth to be tested, or with the symptoms that could lead them to possibly being a person under investigation. And that is why, Kevin, that we are going to again expand our testing, and we're going to start testing more people. And I know, and I said this yesterday, that if we test more people, we'll see more of an infection rate. But we need to do it because we want to make sure we know exactly what is going on in the communities. As you know, there are asymptomatic people that could be tested positive. And then, of course, there's the mild to moderate symptoms that are advised to just stay home. So as our supply of test kits and test supplies increase, we will be expanding our testing capacity. So Linda,
Yes.
you want to add anything?
Yes, Governor, thank you. And yes, you heard 11 last night, but the 11 was only for the public health laboratory. That was not inclusive of now that GMH has the Abbott ID now test kit. So now they are able, with the machine, they're able to do their own testing. And we have a time frame where we receive all the reports. And normally Stephanie will get all that information and she compiles it all by 12 midnight. And then we report that on the next day, which is the sit rep that you see, right, what we're doing. And again, I made some phone calls and I asked several of our providers, including private clinics, why are you just not getting any more individuals coming in? It's been slow in the private clinics. Also with the Department of Public Health, you didn't see that big surge as when we started. A lot of them may just be settling at home. And again, because their symptoms are very mild, they feel that they're going to just weather it through and they don't bother to come into the clinic. Now, if they do come in, please bear in mind that we are going to test them. And again, the priority will be there. And those that are asymptomatic and they do get a nasopharyngeal swab at any of our public health facilities or even within the private facility or even at GMH or GRMC, they will be delivered to the laboratory and they will be tested. Now, again, if they're going to be tested and they're asymptomatic, they'll go through our commercial DLS and those results will come out. In fact, I have the data as far as 149 up to this date of April 16 that have been tested and 5 have been positive and 144 have been negative. And so even with GMHA, the total, since we started having them do their own testing to this day, overall is 26 tests that have been conducted and none have been positive and 22 have been negative and 4 are due to follow-up. Stephanie, would you like to add anything else in terms of what you see in the laboratory as well? Since you're residing in the lab, she practically lives in the laboratory. So would you like
No, I
to?
think you covered it very well. We're seeing just fewer swabs coming in. And so we're working on broadening our testing guidelines. And as our testing capability expands in the laboratory and across multiple testing capabilities, DLS, GMH, et cetera. But yeah, just as Director Dorsey mentioned, the talking with the private clinics and other clinics around the island, just maybe slow, fewer swabs have been coming in.
Right.
I have to also say that the measures that we have put in, our proactive, early, and aggressive measures that we have put in since March 13 or March 14, Kevin, has certainly been successful, as we have seen through the journey that we've already gone through, where we have been now experiencing a decrease in positiveness. And so the measures is working, and I want us to continue with these measures as we continue on down, so we can for sure, when we start implementing our recovery plan, that we don't turn back into reinfection. And so the strategy also, as Linda said, is that now we're going to expand our guidelines and we are going to go out and test more people and do contact tracing also along with the testing. Those are some of the measures that need to be put in place and to continue on in order for us to contain and continue with the success that we are seeing.
Right, and then we're also going to be looking at sampling the size of the population, and we're working with Dr. Thing Hancock in that effort. So yes, as soon as we get more of our expansion capability, we will definitely do that, and then we can test more people, and then we'll have a greater incidence and prevalence rate of COVID-19 on Guam.
Thank you, Kevin. Mary on his Business Journal, Maureen.
Buenas, everybody. Buenas, Governor.
Buenas, Maureen.
I'd like to ask you, Governor, when the Department of Labor, the Guam Department of Labor, will be ready to receive unemployment applications, and when the Department of Rev and Tax will be ready to disperse economic disaster checks to everybody.
My understanding and my information is that the Department of Labor is already accepting applications, and I know they're starting to do it online. And I also know that they've been reaching out for quite a while with the chambers and also with business entities and employers to encourage them and persuade them to start applying, to have their employees start applying for the unemployment program. The economic recovery checks have been mailed out. The beginnings of the checks have been mailed out yesterday afternoon. So people can start probably seeing these checks next week, Monday, Tuesday, or even Saturday. I don't know how fast the mail is.
Okay, thank you. So the government of Hawaii is talking about reducing government workers' pay by 20%. Given the low income the government of Guam can expect, will the government of Guam consider a similar measure? And if not, can some of the government workers be deployed, the ones that are at home, to assist DOL and Reventax?
So was your beginning statement that the governor of Hawaii is decreasing the income of people by 20%? Did I hear you right?
Government workers.
Okay. So there are no plans for our government to decrease income of our workers. There is already a movement of moving people from various agencies over to Department of Labor. And we are also hiring people at the Department of Labor to help with the massive work that needs to be done to not only produce and give out the weekly checks, but also to maintain and sustain the accounting of those checks and record keeping of those checks. Remember, it's a weekly check for 39 weeks. So.
Thank you, Maureen. Next is Guam Daily Post, John O'Connor.
Hello, Governor.
Hi, John.
Hi, thank you. So, as we talk about future recovery, and as you've indicated, what's happening to our Asian neighbors, we don't know how long the situation is going to affect them, and by extension, our major tourism markets. So, how is GovGuam preparing for the worst, for a potential recession, when people are running out of money, when the federal relief checks run out, when hospitality and retail jobs potentially take months, if not longer, to bounce back, and when we might be seeing new regulations or travel behavior? How far into the future is GovGuam planning for how to keep the government and the economy afloat, given these new realities?
Well, we plan our government to be up and running, and we plan our government to moving forward to always be there for our public services for the people of Guam. Our plans are, of course, to continue with what we are doing right now. Our plan is to work very closely with our tourist industry to support them in any way to start bringing back our economic growth and our economic situation. Our plan is also to work closely with our private sector to make sure that those stimulus programs are being given to them. Once those stimulus programs, those loans, and those grants that are being sent over through federal aid is done, I think we will grow. We will come back with our economy. It's probably not going to come back the way it was before this coronavirus, but I suspect within a year that will happen.
Thank you, Governor. So going back to the Hawaii pay cut, yeah, you're right. We haven't reduced our payroll, and we are increasing it with differential pay. There may be the perception that our actions don't match what we're seeing out there in the economy. What are your thoughts on that?
So can I just make a comment about the differential pay? The differential pay isn't given to the workers because we want to just increase their pay. They're given to the workers to make up for the risk that they are incurring and they are exposed to out there. These are your frontline workers. These are your workers that leave their families, work in areas that are very, very much high risk in exposure to COVID. And so as a way of compensating them for those sacrifices, that's what the differential pay is for. It's based on risk, and it's our ability as a government, as a people to recognize that and to say to them that because of that, we feel that the work that you do is of greater value. Therefore, we are giving you some compensation to make up for that risk and that exposure. And so as far as the government employees, I always believe this, and maybe people won't agree with me, but the longer, the more, the better you employ your employees, the better our economy and the quicker our economy can come back. Because remember, these employees are your consumers also. So if you allow your employees and if you work with your employees to continue giving them the buying power, and once we start lifting restrictions, they will go out there and as consumers will consume the goods and services that our private businesses provide. So it's a situation where, yeah, maybe the perception is that, okay, so the economy is down, people's hours are being decreased, employees are being laid off. How come the government of Guam isn't doing the same thing? And I have said this and I will say it again. As long as I can pay the employees of the government of Guam, I will continue to employ the employees of the government of Guam. The business communities also, I know what they're going through in terms of their businesses are shut down as a result of the coronavirus. Therefore, their operations can't be sustained, and therefore they have to make whatever decisions they have to make. However, we also, the federal government recognizes this. Believe me, they have. And they're pouring in federal aid to help these employers and the businesses come back as fast as they can. So, you know, there's the PPP program, there's the EIDL program for our small businesses, and I know that they're taking opportunity and advantages of these aids. So it's not that we are not also supporting the businesses. We are greatly supporting the businesses with the federal aid that is coming down from our federal government.
Thank you, John. Next is KUAM, Nestor Lecanto.
Good afternoon, Governor.
Good afternoon, Nestor.
I wanted to go back to the recovery panel of advisors. Can you tell us who might be some of the people on that, and is it going to be a bipartisan group? Because what it appears to be emerging in the States is that it's becoming a political question where one political party seems to be favoring reopening as soon as possible, while the other political party may be favoring delaying it until there's absolute certainty that the crisis has been conquered. And so I was wondering if you could elaborate on who is on your recovery panel and if that's going to be a bipartisan group.
Okay, so I don't know their political affiliation because that wasn't my criteria in getting our recovery panel. My criteria was more experts that could help me with good advice. So my lead person there is Dr. Ricky Hernandez, who is the Deputy Director for GITA. Then we have the chairman of GITA, David John, who is also the, a very successful businessman. Then the president of Bank of Guam, Joaquin Cook, is on there also from the financial part of the business. Economist Joe Bradley is there. We all know Joe Bradley. He's been a very professional, very expert in the economy, and has a history with working within not just the government but the private sector. We have Christine Belletto, who's the chairwoman, I think, or president of the Chamber of Commerce. We have Holly, who is a board member of the Women's Chamber of Commerce. We have Talar Laguatnia, who's the president of the Guam Visitors Bureau. We have Dr. Mike Cruz, who is my Surgeon General and also the head of the Physicians Advisory Group. We have Dr. Thane Hancock, who is the epidemiologist from CDC here in Guam. I'm trying to think who else. Of course, my Chief of Staff, Tony Babalta, and the Lieutenant Governor. I think I got everybody.
Yeah, sounds like a very well-rounded group, Governor. Thank you. Second question is, as you know, the legislature did not pass the curfew bill by Senator Amanda Shelton. I wonder what your reaction is to that, and is that going to change any of your current programs, such as the road closures?
I am actually very disappointed that they did not pass the curfew, as that was one of the asks that I did when they came to me and asked me, Governor, we would like to help you in any way. What is it that we can help you with? And I asked them if you could set up a curfew policy, because that would be a really good measure for me to do, to make sure that that we understand, or that we know where people are going to and so forth. But that did not happen. So yes, I am very disappointed in that, but that's not going to stop me in making sure that the measures that we put in are measures that's going to monitor people's movements and access to roadways. Because as you know, and I continue to say, the better you stay home, the least that you travel will again be the tools and the armaments and the bullets to fight our coronavirus.
Thank you, Nestor. Good point, Nick Delgado.
Hi, Governor.
Hi, Nick.
So there was news out of Yap State yesterday about a suspected COVID-related death. It was a similar situation we saw with the CNMI's first case. And so with that in place, I was wondering, we understand that a man in his 40s died on April 12th in the morning at GRMC from cardiopulmonary arrest. And he had multiple symptoms, we heard, of COVID-19 prior to his passing. So my question is, was a swab taken of this particular patient to confirm if he was a suspected COVID-related death? And if so, was that reported in public health's numbers? And how many other suspected COVID-related deaths have happened on Guam? And were there any tests?
You know, Nick, I have to say, honestly, I don't know. It's not been reported to me, so I don't know if a swab was taken. I don't even know the case that you're talking about. I don't know if Linda does.
Right now, as I speak, if there's any request for any swabbing, and it usually is done by GMH, and if they cannot do it, then they will ask us to do it. And of course, I have not heard at this time if they did one. However, if they did, then of course we'll go ahead and have them do the testing, or it can be referred to our laboratory to do it as well. I know in the past we did have some swabs done on those that have passed away that were PUIs. Those I'm very much aware of, and that has been done. And so with this current case of this individual being 40 years old, I haven't heard of that to this day yet.
Okay, so thank you. That was the answer I was wondering too, specifically, is if we were checking people or swabbing people who had passed away who could have been PUIs. And so thank you, Linda.
Yes, when we do have the pathologist that is available that also can do it if they already are transported in any form of fashion. But at this point in time, as you know, we have had our ability to do that, and we respond quickly when that does occur, as you know. And once it is confirmed, we do the next measures to ensure that if it is positive, that we will bury the body within 24 hours.
Okay. That's what I was wondering, if how many swabs of people who passed away were PUI that you guys have done, and then how many of those did come back positive. And on that note, in testing, I was also wondering for an update on where we are with getting more tests so that we can expand our testing capabilities.
Right. As you know, we've done, I know of 2 so far that we have done, and requests has been made, in fact, for a body that has already decomposed, and we've already communicated with Dr. Thane Hancock that that can also be done with the help, of course, of these specimens being brought to the Atlanta CDC. And so that I'm aware of. In regards to our test capability, we are also having, as I mentioned earlier, we're still waiting for our 460 boxes, which translates to about 4,600 tests. With this new AB ID now, we have already gotten our 2 orders, and we've also asked FEMA for more orders to build up our capacity, also not only at GMH, but also at Guam Regional Medical City. And that request has gone all the way up to FEMA. And I'll be hearing shortly if that request has been granted. In addition to that, we're increasing not only the capacity, but of the microbiologists that would be able to conduct these multiple testing at our laboratory utilizing more than 1 machine. And at this point in time, we will have the capability for about 3 to 4 machines. And so with that, we also filtered up through the chain of the FEMA to do the request for those 2 microbiologists. And we've gotten through all the forms that are required with the help of Dr. Thane Hancock. And we've answered every single question in great detail regarding the specific job description that microbiologist will do. And hopefully that will be approved. And having said that, we also are in contract with Diagnostic Lab, and that will further increase our capacity. We're also looking at other machines that they will be able to provide for us to do like 300 tests within 2 hours. And so that MOU is in motion, and we're about to finalize that. And again, we continue the commercial capacity. So we're having all these entities testing. Now, how soon we get these orders? As we get one, we ready order the other. And so it's the ability for us to get it. I've asked my laboratory how soon, within a week or so. Usually that happens, or by the end of April. That I know for sure.
So maybe Mr. Esteves can add some to that. He is our supply person. He knows about the inventory on island, as he's the one that tracks it. Do you want to add
Yes,
anything?
so as part of that order, there was a request put in for 5 additional Avid ID machines, as well as the National Guard, Guam Army National Guard received 1 BioFire test machine. The staff has been trained, as well as a BD Max that has arrived and is getting calibrated at the Guam Regional Medical City. And so our test capacity is increasing. Now, it is important to keep in mind that these different testing machines require different types of tests as well. And so it's a balance of managing the machines as well as the testing capability. However, we do feel confident that as manufacturing is starting to ramp up, the diversity in terms of the supply economy is going to allow us to start building up our supply and stockpiles. And so I'm confident that we will be getting more tests and to be able to facilitate very deliberate and I want to say accurate testing for our people.
And all of these machines that we have already mentioned are FDA approved or approved through the emergency utilization authorization. We want to make certain safety is in place, and we also want to make certain that we are in compliance with Centers for Medicare and Medicaid Services. Thank you.
Thank you. Next is I-94, Adrian.
Hi. So Dr. Hao Win was on our Containing COVID radio show on I-94 this morning, and he mentioned that Guam Customs confiscated 3,000 rapid test kits that were brought in by a local wholesaler, and they're not FDA approved. But Dr. Win said that they would be used to conduct testing in the community as part of a study that the advisory group hopes to utilize UOG resources to help conduct. So can you please share more about whether it's true? Are these rapid test kits from South Korea? Are they different from the test kits you, Governor, have been strongly against? And also, who is the wholesaler that made this purchase? Can you share more information on the study?
So I can't speak to the study right now. I know there were some discussions being made, but ultimately all approvals will still go through the governor with regard to any types of testing or studying being done using anything other than non-FDA approved or authorized testing. I don't believe, and to my knowledge, the test kits in question were not confiscated. They were brought by the wholesaler because of the concern that the test kits were not FDA approved. And so that's the thing that we're working with as part of the economic road forward is I'm making myself available to the Chamber of Commerce and anybody who wants and intends to bring in medical supplies and equipment to Guam to ensure that they're validating the actual products. And because for example, I can speak to the product in question. The seller manufacturer gave every assurance to the wholesaler that it was FDA approved. However, they did not understand that the approval they were selling it on was the FDA of the Philippines, not the United States of America. And so these things are happening because of the inexperience of vendors who are not normally medical wholesale vendors and suppliers. And so again, the intent is not for confiscation for our internal use. It's for the safety of the healthcare community and the public at large to ensure that they get quality products.
Yes, and we were also warned with a letter from the FBI that there are counterfeit products that are out there. And so we want to ensure that the safety is in place.
Your follow-up question?
Okay, so yeah, for my follow-up question, just going back to your recovery panel, I question if former Governor Carl Gutierrez, who is your chief economic advisor on international affairs, will he be used to assist with your economic recovery panel, as you know he has experience with disaster and crisis recovery?
Yes, I actually asked our chief of staff to loop in former Governor Carl Gutierrez, and he works very closely also with GIDA and with the chair of GIDA and also with the business development portion of GIDA.
Thank you, Adriana. And now for some closing remarks from our governor.
Thank you. Across our island, many people have risen to the occasion by donating meals to healthcare workers, raising funds for our frontliners, and offering kind messages of support. This battle will be much more difficult without all of your help. Since the start of this pandemic, businesses and organizations have taken small steps in our great struggle against COVID-19. Their actions have helped to prevent further widespread transmission of the virus. For today's COVID hero, I want to acknowledge the Iglesia Ni Cristo Church. Earlier this month, after contact tracing, public health officials identified and named Iglesia Ni Cristo Church for a cluster among its faithful. This was a hard pill to swallow, not only for this church, but for all denominations, especially in these unprecedented times when many of us turn to our faith. Examples of this can be seen throughout the world, most notably in a South Korean church where one woman spread COVID-19 to thousands of others within her congregation. Despite being identified as a cluster site for the virus, the Iglesia Ni Cristo Church stepped up and worked in tandem with public health to identify close contacts, get them tested, and contained the spread. Like the Archdiocese of Agutnia, the Iglesia Ni Cristo continues to adhere to our social distancing guidelines by migrating services online and distributing educational materials to their members to keep them home, for now until we can return to places of worship. Thank you, and Sejus Masi.
Thank you, everybody. We'll see you next Monday.